Hello, my name is Larry. This is my channel on living with stage 4 metastatic prostate cancer, and today I'm going to give you an update and my 3-month checkup with Dr. Collins, my hematology oncologist. And at this point I would just like to ask you for please subscribe to my channel if you like it, and please give me a thumbs up for the video. So this consisted of several things. The most important one to my mind, it was the PSA test, which is still less than 0.02. That's the best reading I can get on this test that they give me, so I'm very happy about that. It means the Lupron that I'm given is holding my testosterone low, and that effectively is keeping my cancer from growing so far. I'll talk more about that later. Also, I had some comprehensive blood testing done. I had a comprehensive metabolic panel. They're all blood tests. I also had a complete blood count test done and an auto differential, and really my doctor was not concerned with any of the results there, even though my red blood cell count and my white blood cell count were slightly low. That's typical for me for some reason. I'm not sure whether it has to do with the cancer or not, but I looked at the trends. My Geisinger that I have lets me look at my blood panels, all the testing that I have, and it also lets me look at a graphical depiction of what's going on with me. So my red and white blood cell counts are typically low, a little bit. They're not very low, just a little. So so it looked like a good result. My PSAs are low, my blood count, and all the blood panels they did for me are within range pretty much, except the red and white blood cell. Then she asked me if I had any more questions, and I wanted to question her on the Lupron injections, which I get every 3 months. And my question was, what happens when the Lupron doesn't work anymore? And the reason I asked that question is because I know that eventually, for most patients for metastatic prostate cancer, stage 4, that what happens after you've taken a drug like Lupron, which is what they call an anti-androgen therapy drug, even though you're taking the drug and your testosterone is still low, that the cancer starts growing again. So I asked her a couple questions. One is, how long typically do patients respond to the Lupron drug, the ADT drug? And she told me that's about 3 years, typically. And I told her, well, it's been 2 years and 10 months for me since I started taking Lupron. But, you know, typical doesn't mean that that's going to be that way for me. It could go on for a long time, or it could have been shorter. But right now I'm about 2 years and 10 months. So the other question I had was, what happens if the Lupron does quit working? Even though it's holding my testosterone down, what happens if, even with low testosterone, my cancer starts growing again? And they call that either castrate-resistant prostate cancer or hormone-resistant prostate cancer. And she said that, well, it all depends on the type of cancer you have, where it is in your body. She goes, there are alternatives, which are, among them are chemotherapy, immunotherapy, trying other hormone therapies. Instead of Lupron, there's a drug called abiraterone. Maybe that one would work. So I guess I'm worried about something that hasn't happened yet, and I'm not going to do that. So if you have someone, a loved one who has stage 4 metastatic prostate cancer, or if you're the patient, I would advise you to just stay in the game. Enjoy every ice cream cone. Enjoy your family. Enjoy your friends. I don't know if you're in a heat wave like I am here in Northeast Pennsylvania, but it's like the third or fourth day of 90-degree weather, 93 degrees today. It's a little humid. It's bad. It's oppressive outside. So just enjoy every ray of sunshine or your air conditioner, if that's what you're like. And enjoy your Perrier water. The candle is lighted to fight the darkness, and there's my peace sign. So peace to you all, and I'll see you later.